Good morning. I'm just going to call us to order, but also put us at ease. Thank you. We'll resume shortly. Good morning and welcome back to the Health and Human Services full committee. I'm Delegate Rodney Willett, your chair. Thank you for being with us today, and we're going to take the roll. Excellent. We have a quorum. We've got a couple of committee reports this morning for bills that were already heard in sub, and we're going to start with Chair Tran and Social Services, which just met moments ago.
Thank you so much, Mr. Chair. The first bill up we have is Senate Bill 73. I'd like to move the committee amendment.
Second.
We have a motion that's been properly seconded to move the amendment. All in favor say aye.
Aye.
Any opposed? No. So that's before us.
Thank you, Mr. Chair. Senate Bill 73 from Senator Srinivasan directs the Virginia Department of Medical Assistance Services to provide training to local school division staff regarding assisting schools in effectively navigating the laws, policies, rules, regulations, and guidelines governing Medicaid billing for reimbursable services rendered at school sites. The subcommittee recommended reporting and referring to appropriations unanimously. However, we've learned since that given the language in the FIS, we do not need to refer this bill to appropriations. So I'd like to move that we, based on the subcommittee's recommendation, to report Senate Bill 73.
Second.
Thank you, Madam Clerk. As amended.
As amended. We have a motion that's been properly seconded to report with amendment, SB 73, and we'll go on the board. And that reports the amendment by a vote of 14-2.
Thank you, Mr. Chair. Next up, we have Senate Bill 409. This bill permits, from Senator Boysko, this bill permits residents of assisted living facilities to have electronic monitoring devices placed in their rooms. The bill defines an electronic monitoring as a use of a surveillance device with a fixed position video camera or audio recording device or a combination thereof that's installed in a resident's room and broadcasts or records activities or sounds occurring within the confines of the room. The bill contains several provisions to establish privacy guidance and if there is a roommate also in the room for consent. The subcommittee recommended reporting by a vote of 8-0, and I so move.
We have a motion that was properly seconded to report SB 409. If there are no questions about the bill, we will go on the board. And SB 409 reports by a vote of 17-0.
Mr. Chair, next up we have Senate Bill 556 from Senator Perry. This bill expands the mandatory reporting requirements for certain people in their professional or official capacities to include certain offenses related to children and certain obscenity and related offenses, and applies all such mandatory reporting requirements to all public and private school athletics program coaches, directors, and adult volunteers, including those associated with interscholastic teams and clubs. The subcommittee recommended reporting and referring to appropriations by a vote of 7-0, and I so move.
Second.
We have a motion that's been properly seconded to report and refer to appropriations, SB 556. And if there are no questions, we will go on the board. And SB 556 reports by a vote of 18-0.
Mr. Chair, next up we have Senate Bill 564 from Senator Sturtevant. This bill requires every person that constitutes or operates or maintains an unlicensed care home as defined in the bill to register the home with the Commissioner of the Department of Social Services. The subcommittee recommended reporting and referring to appropriations by a vote of 8-0, and I so move.
Second.
We have a motion that's been properly seconded to report and refer to appropriations, SB 564. If there are no questions from the committee, we will go on the board. And SB 564 will report and be referred to appropriations by a vote of 18-0.
Mr. Chair, I believe that concludes our committee reports. We had 2 other bills that were carried over, and I don't think we need to, we don't do that as part of our full committee report. Thank you.
I think we're good there. Thank you so much, Madam Chair. And what we can do, we do have a report, several bills from the Health Committee. I think, and these are not in a block, we're going to look at these individually. So I think we can just go ahead and jump. I can do my best to summarize these. Maybe a little help from the, the clerk will get through this. So let me switch my notes here. Okay, so we're going to turn to SB 278 from Delegate Srinivasan. This is related to 340B, a lot of discussion in the session around 340B drug pricing. And basically what this report, what this bill now does is recommend the creation of a work group to do a comprehensive evaluation of the impacts of the program and what's happening in the Commonwealth. A lot of questions around transparency of the program and particularly the availability of pharmacy services in the rural and underserved areas. So this would take a deep look at that. There was an amendment too, so I should move the amendment.
So
We need to get a second on the motion.
you moved, there was a second.
There was a second, okay. So we've, and all in favor? Aye. Okay, so we have the amendment before us. If there are no questions on that, I'll take a motion to, the recommendation was to report with amendment.
So moved. Second.
We have a motion that's been properly seconded to report with amendment, SB 278, and we'll go on the board. And that reports by a vote of 18-0. Okay, next up we have SB 374. This is from Senator Boysko. This is adding an additional newborn screening requirement for what's called Gaucher disease. The senator gave the subcommittee a briefing on that disease and the folks who were affected by that, could be affected by that. This does have an amendment?
I move the amendment. Second.
We have a motion that's been properly seconded to move the amendment to SB 374. All in favor say aye. Aye. Any opposed, no. So that's before us. There's also a recommendation that this go to appropriations. And the recommendation then is to report SB 374 as amended and refer to appropriations.
So moved. Second.
We have a motion that's been properly seconded to report SB 374 as amended and report that to appropes. We'll go on the board. And that will report and refer by a vote of 19-0. Next up, we have Senate Bill 392. This is from Senator Jordan. And I'm going to have to read this one because I'm not as familiar with this. Directs the Board of Health to establish guidelines for the cleanup of residential property and other sites formerly used in the manufacture of illicit drugs. Under current law, the Board of Health is only required to establish such guidelines for sites formerly used to manufacture methamphetamine. So this is expanding the coverage there. There is a request that this go to appropriations. So the report here is a report, but refer to appropriations.
So moved. Second.
We have a motion that's been properly seconded to report and refer to appropriations, SB 392, and we'll go on the board. And SB 392 will report and refer by a vote of 20-0. Okay, next up, we have SB 633. This is also from Senator Srinivasan, and this relates to directing the Department of Health to publish on its website a document for event planners and event venues to provide prospective clients containing a notice of the emergency medical services personnel that may be made available for the events and information regarding the benefits of having medical support available for large high-risk events and other requirements related to that. The recommendation of the committee was to report this, and I so move. We have a motion. It's been properly seconded to report SB 633, and we'll go on the board. And SB 633 reports by a vote of 20-0. Okay, a few more bills that were before the committee. Oh, we've got our chair here. Chair Hope, do you want to pick up? No, we would much rather have you than me. I can tell you that right now. If you want to pick up, we're on SB 183 and then SB 683. Those are the two remaining ones there.
Yes. All right. Thank you, Mr. Chairman. Appreciate it. Senate Bill 183, we had an amendment, and I would have moved the amendment.
So moved.
We have a motion that's been properly seconded to move the amendment for SB 183. All in favor say aye.
Aye.
Any opposed? No. So that's before us.
Thank you, Mr. Chairman. Senate Bill 183 directs the Board of Health to promulgate regulations requiring all restaurants to alter their substitute food due to consumer-identified food allergy or sensitivity to a place and identifying marker on any food item prepared for delivery or carry-out service has been altered in substitute. The subcommittee recommended reporting with amendment by a vote of 7-3, and I so move.
Second.
We have a motion that's been properly seconded to report with as amended SB 183, and we'll go on the board. And SB 183 reports by a vote of 14-6.
Thank you, Mr. Chairman. Now, Senate Bill 683 allows the Commissioner of Health to petition the Circuit Court for jurisdiction which a public or private waterworks is located for appointment of a receiver for such waterworks. Currently, such appointment of receivership is only for private waterworks. The subcommittee recommended reporting by a vote of 6-4. Unfortunately, I was one of the 4, and so I want, if anyone would move that, I'd appreciate it.
So moved. Second.
We have a motion that's been properly seconded to report SB 683, and we'll go on the board. And SB 683 reports by a vote of 18-2. Thank you so much, Chair Hope. And with that, we are an efficient committee. We've gotten through our agenda. I want to do two things before we adjourn. One is just to let everyone know, including the committee, that we're done. We've done our work. And I want to thank you for doing this work. We've reviewed an amazing number of bills. So thanks to this whole team. But wait, there's more. We are going to have, we're hoping to have some informational presentations. I know schedules are busy, but since we've got everybody in Richmond, we thought it'd be a good opportunity to hear a couple of different agencies. We got some new players there, a lot going on. So stay tuned. We will use this time for that. And if you are available, please join us for that. But last but not least, I really want to recognize the team and this amazing effort and what you have done, starting with my ace vice chair, Kathy Tran, who's just keeping me straight up here. And social services sub-chair. Chair Hope on the health, carrying just a huge number of bills. Really appreciate that. Thank you. Thank you. Chair Price on health professions, also just an incredible number of bills coming through there. And our newest chair, Deborah Gardner, Chair Gardner for behavioral health, taking on all those hard bills that I used to have to handle in that position. Thank you. Jane on the clerk staff, Chandler, the whole team, Susan, IT, the pages, you really have done. We've seen a lot of bills in this committee, so I really want to thank you. I want to thank all the members for your patience. This is a heavy lift being on HHS. But I think we've really gotten a lot of good legislation through here. And again, thank you for everyone. With that, we are adjourned.
We should thank our host.
Thank our host. We can thank those.
Your chair.
Okay, well, I'll take that. Yeah. Thank you. Thank you. No, it's been an honor to serve. With that, we are adjourned. Mr. Chair.